Bear, it's okay. Oh, pup. Will, my partner, woke up to a banging sound. And I've just seen Bear just in the middle of a grand mal seizure. So she's just paddling and you know, in a real tonic sort of state. It's just the most horrific thing to see happen to your own animal. I think there's something different about it being a patient in a hospital setting. Everything's so controlled, you know what's going on, you know, you've got all your medications there, everything to act, but when it's your own animal, it's just so much more emotional and distressing. A huge shock because this is the first time this has ever happened.
Hey, you're okay, you're okay.
Bear's come out of the seizure. She's not neurologically normal yet. She's pacing around, she's panting, she's wanting to drink a lot. She seems really ravenous. She's hanging around the fridge. Just want to see how quickly she sort of gets through this phase and recovers.
Hey. Sit.
Just got to calm, pup.
Sit.
3 hours later, the signs are promising.
What have we got here, Buzz?
Hey.
Bear's still slightly agitated, but much to Danny's relief, she's almost back to her old self.
Bear is full of energy, full of love. She loves every human she meets.
You got it, you got it.
She's just our best mate. We just want to have her with us all the time, wherever we go. She's the best company.
Good old Bear, she's back.
Will's also relieved. Big, gentle Bear has helped him through some tough times.
We got her as a puppy. She's been great for me after discharging from the military a fair few years ago now. She was a great companion, so that's been great.
But Danny is still anxious to get to the bottom of Bear's sudden early morning seizure.
Of course, my emotional brain is just leaping to the worst case scenario. The first thing I'm worried about is that she has a brain tumour. So, yeah, we really just need to get more information to know why this is happening.
She'll be right. You've had a big
We will get to the bottom of it. We will get you sorted.
She's my baby. She's everything.
You hear me, Bear? We're going to get this sorted.
All right, just sit down.
Stay.
You sit
Good
down,
girl.
shall we?
Stay there. Good girl.
All right, so I'll just check how well she's seeing
Yep.
things. Now the Bear has somewhat recovered from this seizure, I want to do a neurological examination. Good girl, puppy.
So what are you doing?
Essentially, she doesn't know this is coming, and she's seeing it drop in front of her face, but it's not got a smell, it's not got a sound or anything, so it means that she is seeing. So that's good. Hey, you're a good girl. Just checking that.
By checking Bear's reflexes and response to light,
Girl.
Danny can work out if there are any early signs of brain abnormality.
Good job, puppy doggy. Hey? All right, so I'm really happy.
Yep.
That looks all
Good girl, come
normal. Good girl, boys dog. Sorry. I'm sorry.
Was it fun?
I'm sorry. I am really happy with the results on that examination. I couldn't see any abnormalities there, so that is a good sign at this stage. So the next step for Bear is to get some bloods, just to rule out anything that's going on outside of her nervous system that could be causing these neurological signs. Fair enough. Oh, good girl.
You get the picture in your head that you're going to have a dog that lives for, you know, however long their life expectancy is. And then to sort of suddenly think, God, she could be gone in, you know, a matter of months, weeks, days, and it's not known until we have more answers. Yeah, it's scary.
In you come. Good girl. This way. Good girl.
It's just a short trip to the nearby vet clinic where Danny works.
Hey, Lou.
Hi, Danny.
Just brought Bear in because I want to get some bloods. She's had a seizure this morning.
Oh no, dear.
So I'm really not sure what's going on. I am hoping that it's just something like epilepsy that we can manage.
Yeah, of course.
But it's the first seizure, so we'll just have to get some, get some information.
Definitely. Come on, Bear. Up we get.
Oh,
Yeah.
Vet nurse Louise is helping Danny take Bear's blood sample.
Alrighty, Bear. Good job, almost there. Very good. Good girl,
Beautiful.
The findings will hopefully give Danny more clues about what's caused Bear's distressing seizure.
One of the hardest things about being a vet and a pet owner is when something does go wrong, you know what the range of things could be. From the simplest thing all the way to the most sinister. So it can be incredibly stressful, and I do get very clouded in my thoughts. I'm a bit nervous waiting to get those blood results. I'm really crossing my fingers that nothing comes up on them today. Good girl. I'm so sorry. All those bloods there, are they?
Yes, we do have them there.
See.
They're great ones for you.
Okay, good. So there's nothing going on outside of the brain, it looks like, that could be causing that. So that's really good. Good. Thank you. Yay. Yay. What's doggy? Good job, Papa. All right. We're not out of the woods. There could be something else going on, but for now, it is good news.
Some good news
Yes.
today.
Yes. Hey, give us a bit of a scare, puppy doggy. Hey, you good girl, puppy. You good girl. Hey. It's been a big day, a lot of emotion. So now we're going to go home and try and have a relaxing night, and Bear is on the bed tonight with lots of cuddles.
Back home with partner Will, Danny is doing her best to stay positive and plans to start Bear on medication to hopefully ward off any further seizures.
One step at a time, hey puppy. It's all right, Bear. It's okay, pup. It's okay. Just let her go. Oh, gosh. Oh.
The next day in Melbourne, it's another traumatic morning for Danny and partner Will.
It's okay, Bear. It's okay. Good girl. It's all right. So this morning, Will and I were woken to Bear having another seizure. It's all right. Shh. It's okay, Bear. Shh. This is a really strong one. It was a fairly long seizure as far as her time frame usually goes, so it was a more severe one this morning, which is a bit concerning. It's okay, puppy. Yeah, it's disappointing that we're still having seizures. You okay? You okay, Pop? It's okay.
Pretty distressing. So yeah, it's hard to see. Poor Bear.
Long time.
Hey, Bear.
It's okay, puppy.
Hello.
Good girl, hi.
Hello. Good girl. You're all right.
We started her on medication, but I'm really concerned that we have not got adequate control. And I think the next step is going to be getting a brain MRI. We've exhausted everything now. She's had the highest dose of both medications as frequently as she can have them. So that's not working.
Yeah.
So we need to act on this, because otherwise, if she continues to have more seizures within 24 hours, that's when it becomes dangerous.
Yeah.
Prolonged seizures in dogs, or any left untreated, can lead to brain damage or even death.
So the reason I want to get a brain MRI scan done is to see if there's anything structurally going on in the brain, like something like a brain tumour. So we need to rule that out before we continue progressing with just medical management.
6-year-old Bear is back to her old self,
You see Bear?
much to the relief of Danny and husband Will.
Bear ended up having her brain MRI, which all came back clear, which was fantastic news and a huge relief. Since then, we've just been trying to titrate her medication to get the right dose to control those seizures, and I'm happy to say that they are well controlled now. So she does have them every now and again, but very infrequent, so it's a really good result, thank goodness.
She's knackered and she's sore, but she won't sleep.
Scott's world is suddenly turned upside down.
Hey, come on.
Ironically, after yesterday's fun first aid lesson, Betty has just suffered a serious injury.
So it was on my day off, and I was taking my son Jackson to the park, and of course Betty comes along, and I literally threw the ball as I always do. And the second time I threw it, she yelped out in pain, and Betty started dragging her legs towards me. Betty's got you. The fact that she'd gone from walking perfectly well to being paralysed, I knew that this was not your average injury. So I literally scooped her up, ran home with the baby, called Zoe. She ran back. Shush, honey, shush.
It's all right, baby. Daddy's going to try and help you.
There's nothing on this right side at all.
Absolutely nothing, is there? She's not trying on that side at all, huh? No. It's all right.
Okay. Yeah, just let her. So straight away, examined her, and I could tell that both of her back legs are paralysed, and this was a spinal injury.
Get her over to Michael.
Yeah.
Despite already being given pain relief, the traumatised terrier is still crying out for help from her best friend.
Take you to Uncle Michael's house.
Come on, let's get it, go. The sooner we get it, the better.
Scott is about to take Betty to specialist orthopaedic surgeon Michael Hamilton to find out if anything can be done.
I need to go and see Michael. Yeah, just see a mate. Who knows more about this stuff than me. Just to kind of, just give me the honest steer. Because my heart is really in my head right now. Come on, baby. Come on. Be brave.
Okay, you guys get the stuff for the car because she needs to get going.
Okay.
Better. Let me love you. Call me, won't you? Okay, as soon as you speak to Michael, call me.
Okay. See ya.
Drive safe, Baba.
Thanks. Good girl. Stay, baby. Stay.
Scott's now arrived at the Cherry Tree Veterinary Practice. His longtime friend, specialist orthopaedic surgeon Michael Hamilton, is waiting to examine Betty.
Hi, mate.
Hey, mate. Right, okay. Hey, Betty. Right, let's get you looked at. Come on in, honey.
The little terrier fell down in the park, and her back legs are now paralysed.
It was kind of weird to see Scotty quite so down. I mean, he came in today, and Betty was she was in so much pain, and Scotty knew it. You know, she's getting worse. He's just really, really worried.
Basically, she was just chasing a ball, and she squeaked, and then I turned around and she was just dragging her legs towards me. She, since can't control her bowels, she can't control her bladder, and she's just getting increasingly painful.
Yeah, she's uncomfortable, isn't she?
Shush.
Give it a sec, Scott. I'm just going to get a little sling. I just need to see if she's got any much voluntary movement there.
Yeah.
I'll be right back.
Okay. Come on, honey. Come on. Come on. I know. I totally feel that I'm in the right place. Michael's known Betty as long as I've had her. So, you know, he has known how much I'm invested in this dog and how much I love her, and he will very quickly want to do the very best that he can as well.
She's got a little bit of voluntary movement in her left.
This looks awful.
Not much in the right, though. Okay. Right.
I just feel very privileged that they've just opened their doors and they've said, come on in, we'll do what we can as soon as we can, and I'm very lucky for that.
The most likely thing by a mile, given how she's painful, is that she's burst a disc in her back, and some of the content of the disc is now squashing the spinal cord. Okay. And then everything kind of downstream just isn't working very well. So that's the most likely thing.
Okay.
What we need to do is we need to try and get a look at her spinal cord and see if it's compressed, and if it is compressed, exactly where is it compressed? Because if that's the case, we can potentially do an operation to decompress, and then hopefully, a bit like a kind of a water hose with the messages going up and down. You put your foot in the hose, the messages don't work. You take your foot off the hose and the messages hopefully start again. We just got to get a move on, see if she's got compression or not, and if she does, decompress surgically.
Okay. All right then, honey. We're in the right place. Yeah. Okay, Uncle Michael will sort you out.
It's going to be wriggly,
Probably. Probably. You're going to be a wriggly girl, are you?
At the cherry tree surgery, Scott is clinging on to the hope that Michael will be able to help Betty walk again.
So what we're going to do, we're going to get her asleep, take some x-rays, then we're going to inject some of this stuff. This is a contrast agent into the space around her spinal cord where the spinal fluid sits. And then we take more x-rays, and then what that actually did, that's going to highlight the spinal cord.
The little terrier fell over in the park chasing a ball and immediately lost the use of her back legs.
She's in a lot of pain, it's getting worse, and so, you know, if we do nothing, there's going to come a point whereby she can't even feel her feet, and then the prognosis gets worse, so, you know, time's kind of the essence. Best mate, dog's in a bad old state, got to bring my A game to fix this dog. Try and get her nice and straight. Okay, right, everybody out. When we stick the needle in, if we're in the right place, we'll see a little twitch, and then we might see some spinal fluids coming up through the needle, and then we're going to inject the contrast.
I thought I was going to lose her. I was stripped of all control, and I had to put my faith in someone else. It really did clarify just how much she means to me.
So there it is, mate. If you look at the fluid underneath, just here, okay, this is all good, but you just kind of lose it around about here. So this is our one here.
Okay, but looking at that, you think that this definitely needs surgery, right?
Yeah.
I knew it was bad, but it's really bad.
Operating near the spinal cord has massive inherent risks. You know, the spinal cord, if the cells have died, they don't regenerate. So worst case scenario is she never walks again. Right, happy?
Yeah.
Have a 15 scalpel blade, please. 15 scalpel. Right, so there's a rib in there somewhere.
With all of Scott's family and friends waiting and hoping, surgery begins on Betty's compressed spinal cord.
You know, one slip, if you bang that spinal cord, it's game over.
Scott has decided to be present in the operating theatre, but it's not going to be easy.
Zoe really wants me to be in there just to kind of, you know, hold Betty's hand, as it were. So that's what I'm going to do.
This you can see here, this is actually the last rib, this thing here. Mm-hmm. And the disc that's popped is just under there somewhere. So we need to get into the spinal cord there.
The surgery that Michael's about to do is basically called a hemilaminectomy. It's removing part of the spinal column, the bony parts, to relieve pressure within.
And I think given that she's got worse and she's now paraplegic, we've got to do all we can, really.
It's a worrying moment because, yes, we're going to relieve any compression that might be present on the spine, which of course is great. But at that moment, we're going to know how badly injured Betty really is. And, you know, Michael's going to see a healthy spinal cord or one that's absolutely hammered. I think by the look on his face, I'll be able to tell. I can't believe how deep the exposure is.
It's quite a long way in, isn't it? Okay, so a normal healthy spinal cord looks a bit like cooked squid. It's kind of a white rubbery thing. And as soon as we got in there, it didn't look like that. It was quite red and quite bruised, which is a bit of a worry because that would imply that it's maybe been bashed, and that's bad news for the spinal cord.
How are you going, Michael?
Yeah, good.
Seeing Michael use the drill that close to my dog's spinal cord, I'm freaking out. It's not something I'm finding interesting or intriguing, all the things that I normally would feel when I'm watching a fellow veterinary professional perform their job. This time around, I'm just an owner and I'm not enjoying it at all.
This is the spinal cord, this bit here. I'm not going to touch it, but that's the spinal cord there. And in a minute, we're going to have a little poke under the spinal cord. But this big blob right here is disc material, that there.
And that all shouldn't be there?
That shouldn't be there, yeah. All of that, oh my God, that's a lot.
Oh my God.
All of that.
Look at all that.
Wow, look at that.
Jesus, there's so much of it. Removing this amount
This is good
of
news,
stuff
this is good news.
is good, right?
In many ways, yeah, because
that lot amount of stuff, that removed, reduces huge amounts of pressure on my dog's spine.
Yes.
God, I don't know if I should feel relief yet. Should I feel relief yet?
The slight concern, though, is the spinal cord's quite bashed and bruised. The cord looks bruised. There's some disc material just kind of sitting there, so we removed that, and then we just kind of got underneath the cord, and we got probably the same again, and again, and again. There's the cord, there's one root, there's the cord, there's the next nerve root, and there's nothing under there now. I've been right there underneath, I can't get any more.
And that bruising that you saw initially, do you think that's more?
I think a lot of it was disc material sitting on, so the bit we were looking at was this bit right here.
Yeah.
But underneath there, it's bruised, but it's not quite as bad as I thought it was, so.
Okay.
I wasn't expecting that. This is a prize winner. It's going very, very well. Right, leave the suction on for a second. Is that right, Michelle? Do you see that?
Yeah, amazing.
So what we're going to do now is going to...
Very, very good result, and I know he wouldn't say that to me unless he really meant it. So, yeah. So I'm really happy. Yeah. There's real hope with that now. Yeah, I might actually get my dog back, which is pretty cool. Yeah. Brave girl. Betty's brave girl.
Betty was in a pretty bad way today. She's a grade 4 out of 5. She's what we call a paraplegic. We've decompressed quickly and we've decompressed a lot. So, her prognosis is actually quite good. She's got kind of an 85% chance of recovery. I don't want to jinx things, but I think she's going to do great.
Here we go. Ooh, she's so good. Such a brave girl.
While Michael is cautiously optimistic, he has warned Scott not to expect any sign of improvement for at least a week. A full recovery could take months, but it may never happen.
I will her to walk again. I couldn't think of that not being the case. So I'm just gonna keep hoping that that's gonna happen and that everything that everyone's done today is gonna make that difference.
Daddy loves you so much. Good. Hey, yeah, we just gotta get better. Right? Get better.
Okay, baby. It's physio time. Yes, it is.
It's been 3 days since Betty's spinal surgery. Zoe asked Scott if she could look after the little terrier at home and give her round-the-clock care.
Bit of a massage, don't we, Bits?
Betty's surgeon, Michael Hamilton, has warned them it could take up to a week for the patient to show any signs of movement in her paralysed limbs.
All that blood flowing through the muscle, keep it all nice and stimulated.
There are no guarantees of a full recovery.
I think she's maybe a little brighter in herself, which is good. She's definitely pleased to see people when they come in. She's just frustrated she can't do her usual meet and greet at the door that Betty does like to do, with a lot of licking as well. But yeah, I think maybe a little brighter in herself. I think so, yeah. Stretch, honey bunch. Good girl, that's it. I know. Lay down, lay down. There definitely is something there. There's some sort of deep pain sensitivity there for sure. We're not getting any reaction at the moment from the knuckle test. We're hoping that she'll correct her own paw on that, which she's not doing at the moment, but we just keep testing. She does her physio sort of 2 to 3 times a day. We're just gonna keep testing it. Come on, Betty. You can do it, baby. Spring back. Not today, but that's okay. That's okay, not this morning, maybe later, hey? You are constantly on edge because you want to see an improvement, but you're scared you're going to see something to the contrary. It's really hard. It's really hard. It's what being a pet owner is. And here we go. Good girl, feet down. But it doesn't make it any easier to see, doesn't make it any easier to do, and to watch Betty get so upset sometimes when she forgets that she can't move and she goes to step forward and she goes to come and see you. You see, she just gets genuinely sad in that moment, and she's such a good dog, you know? You don't want to see her like that. Good girl, you're all done. Same again, 2 hours time, yeah? Yeah, same place, same time, Bubba. Come on.
Where's the squirrels? You gotta get up so you can go and play with them. Not that they'd call it playing with, would they? No. No, they wouldn't.
With his work over for the day, Scott can now focus on Betty again.
Where's the squirrel? Where's the squirrel? Where? Where is it?
As a special treat, he's carried her to the local park, and she's lapping up the one-on-one time.
Been a lot of clinical environments, a lot of injections and lots of tablets and lots of treatment going on and lots of sadness. And so to sit in the sun and to see her responding to the birds and the other dogs and the squirrels was just really nice. You know, this is her behaving like a dog.
Oh, what are those doggies doing? Are they running? You'll be able to do that soon. You will. You will.
But right now, there's really not much to write home about. You know, she can't move, she can't go to the toilet by herself, and even though Michael said, wait 7 days, it's just so tough. It's excruciating.
Just try and use your legs, baby.
Hope doesn't even go anywhere near to explain how much I'm willing her to get better, because I'm not even contemplating the alternative because I just don't want to. So she is going to get better.
Start using your legs and you can enjoy it all, can't you? Start walking again. That's what you need to do. Come on then. Trying to see everyone, hey? Go and see all the team. Yeah? Good girl. Here we go.
It's been 6 days since Betty's spinal surgery, and at last, there's positive signs.
Oh my word, look at you.
I know, she's even wagging her tail.
Oh,
look at that.
darling.
Wagging her tail. The first sign of hope, the glimmer, was that Betty wagged her tail at my mother-in-law. Now, usually when mother-in-laws come into the house, you're not that impressed. But apparently my dog was. And look, but she's actually doing her best to stand on her own now. See? Aren't she, sweetie? She's still very weak on the left, but she is so much stronger on the right. And she actually stood up yesterday, which is very exciting, wasn't it?
Who's a clever girl?
Didn't you?
Who's a clever girl? It's literally amazing.
Nice to see her a bit happier and a bit of spirit back, isn't it?
And back to licking.
Yeah.
Back to licking every inch of everybody.
Disgusting.
Wouldn't have you any other way.
You know, everybody needs a win. We can't save every animal. We can't diagnose every problem in a heartbeat, you know? And to have Betty come in today, standing, wagging her tail, happy, smiling, and all of that is the biggest win that you could ever ask for, because alongside her was Scott, happy and smiling, and they come as a bit of a package, those two, I think, and it's just made everybody absolutely lift their spirits, and yeah, it's a good little tonic for everyone to have.
Hey, Jess.
Hey, Scott. Oh,
Hey, look. Who's that? That's your little friend.
She looks amazing.
Yeah.
Oh my
goodness.
She's coming along really, really nicely. She's just starting to stand, and now it's all about trying to teach her to walk.
I've actually got a little something for Betty to help her with her walking.
Oh, wow, that is amazing. Wow, so a little sort of stretchy sling support thing.
That's right.
Made of dressing material. I can even see you've braided dressing material. Can't even braid my kid's hair. That's unbelievable.
All right. She's a special little girl, so had to be done.
The whole team have been just so supportive during this really fairly tragic journey, and I know that both they really want to see Betty and Betty really wants to see them. Good girl.
Oh, Betty.
Ooh.
Look at that.
Wow.
Look at those
Yes, that
legs.
works so well. Every single day I'm seeing big jumps. I'm going to continue to push her as much as I can, offer up everything I can to really just get the dog back that I love.
Come on, clever girl. Look at that. What a good girl. That's it.
And I know she can do it. She's a brave, plucky little dog.
That's it.
There is seemingly a light at the end of the tunnel.
Clever girl. You are so clever. Well done, honey. Show us what you got. Good girl. That's it.
And 1 week later.
That's it. Nice and slowly. Clever girl. What a clever girl. Good girl. Good walking, honey. Well done. Well done. Well done. Good girl.
It was an incredibly special moment when I knew Betty was back.
Come, Betty. Come on.
Summer, my eldest daughter, called her and she actually stood up and walked to her. And we're just so, so grateful for that.
She's all better. She's got all her legs except for that back left one. It's really getting better.
The decision-making process that I went through with Betty, I think, crystallises just how much you need to listen to owners because they do know their animals. And I knew my dog.
Good girl.
I've been a vet for a long time and I've really never felt what it's like to have the shoe on the other foot. And if I didn't take my job seriously before, I certainly do appreciate it now.
That is to take her temperature.
Quinn totally wants to be a vet, so she'll copy anything that Daddy does.
She has 1,000,000.
So poor old Betty, sick or otherwise, she's gonna get the treatment. And Summer is just such a loving kid. They all are. But that's definitely Summer's role is the cuddles, and Quinn's role is the medicine. So it works quite well. Betty seems happy.
I absolutely love Betty. She gives me so many kisses because I do so much nice things. Thank you, Betty, very much.
I think it was really difficult to keep the faith as the minutes and the hours and the days ticked by and Betty wasn't showing any signs of improvement. And it's balancing your emotions at the same time as the kids constantly asking, when is Betty going to walk? Is she walking yet, Dad? Those heartbreaking things that you are protecting them from what might be an inevitable outcome of a paralysed dog. It couldn't have been more difficult.
You can make her better.
I think the journey I've been through with Betty is catharsis. It's literally like someone has written down my life and the job that I do and then showed it to me. And through that window, I can see just how important my profession is to people's lives. And I don't think there's ever a point in my life where I can say that I'm more proud to be a vet.
Today is Lucas's big day. My little boy is getting castrated. And for most dogs, this is a fairly routine procedure. But for Lucas, he's got a rare condition called cryptorchidism, which basically means that his testes are missing. They haven't dropped down. Now, if we don't go in there and find them, he's got a 10 times greater chance of developing cancer. And that's pretty scary. It's quite pathetic because I lose all sense of being a vet. I become a neurotic mother and I've been worrying all night about him having the surgery today. Look, wanna go walkies? For them to be in pain or go through any risky procedures just freaks me out. Come on.
I'm a mess.
Is he being braver than you are?
I'm pathetic.
Lisa's puppy Lucas is about to undergo surgery to try to fix his rare condition, cryptorchidism, more simply known as missing testicles.
Oh, be brave.
Good boy, good boy.
Surgeon Andrew Marchevsky has the unenviable job of operating on his colleague's beloved dog.
He's got nothing.
There's nothing.
No. The problem is when they're, as you know, when they don't come down, they stay really small.
Yeah.
And they're really hard to find.
Yeah.
And his were never going to be big in the first place.
Lisa does have another concern. It's just a little bit embarrassing.
Okay. I have this worry that maybe he could be a pseudo-hermaphrodite. Now,
hermaphrodites have the reproductive organs of both males and females.
I'll tell you the reasoning for this.
Right.
Male dogs in the park have been having relations with him. Could it be possible that he's releasing some female hormones?
Well, I guess it's possible.
So maybe when you're in there, if you want to just have a look for some ovarian-looking tissues.
You're right. Maybe he's been enjoying the attention.
Poor Lucas, you're just a special little boy.
I have to castrate and love him. Don't hurt him. I'll do my very best.
We're all right. I'm not going to cry.
Lisa's puppy Lucas is on the operating table, and surgeon Andrew Marchevsky is feeling the pressure.
Well, it's a lot more risky than if it was just a straightforward castration, because we might have to open him right up. And I think I've just caught sight of it near somewhere.
If they're not found and removed, it greatly increases the risk of cancer.
I've got the first one, so that's a good start. We'll just get it tied off. Got to be a little careful because there's a couple of little vessels around here that if you nick them, they can bleed quite a lot, and I don't think that'd please Mrs. High Maintenance out there. I can't find the second one. It's hiding from me. So it's making my life a little bit more difficult. I'm going to have a late lunch. I found it.
Is it there?
It's there. It's sitting just near the bladder. So it sort of got 3/4 of the way that it should have got and stopped. Ran out of puff. Good news for Dr. Chimes. I can confirm there are no girly bits, so Lucas is definitely a boy. It's a boy.
It's a boy!
It's a boy.
He's a boy now.
So Lucas is not a hermaphrodite.
He's really
That's
a
the good
boy.
news. The
So I
bad
don't know
news,
why he's not
allowed
just that way
home
inclined.
tonight.
Oh, yeah, right.
He's staying overnight.
No, I'll be taking that
He's
drip
staying
pump
overnight.
home. That pump will come home.
Staying overnight.
Can I see him?
Yeah. You can see him.
Okay.
Come on.
Oh, little Lukey. Oh, baby boy. I feel like I'm an owner. It's really bizarre being the one getting all emotional, saying goodnight. Complete role reversal for me. He's a sleepy boy. I've been putting this off for so long, and I'm just so happy that it's over and I can now look forward and he can recover and it's all in the past.
Got a present for you.
They're quite big. They're not bad. Lucas. Excellent. I can prove to everyone that he is a boy. Where's that dog on television?
Lucas has recovered quickly from his delicate operation and is back home with Lisa and Nelson watching his favourite TV show.
These boys are my life. They're my children. I would do anything for them.
On the Gold Coast at the home of Dr. Alex Hines and Dr. Gerardo Poli, partially blind and deaf border collie Diesel is facing a new health battle.
You can see when he stands, his head's tilted to the side.
Yeah.
Like as if the world is on an angle.
Good boy, Diesel. It's almost like when he starts to get really dizzy, he just wants to lay on the floor, doesn't he?
Yeah. Oh, you can see his eyes. His eyes are flicking bad
Yeah,
now.
I can see that now.
I've had Diesel for 13 years. I bought him as a companion for my first dog, Chic, who I've had for 14 years until about 2 months ago. Diesel does miss Sheik. When Sheik passed, he became a lot sadder and a lot quieter. You know, I miss Sheik as well, and she was my first dog. And when I was in second year, I realised I didn't really understand the bond between humans and pets. And I bought Sheik as a way of actually understanding this bond. And I bought Diesel because Sheik needed a friend. Sheik and Diesel were my children, essentially.
But Diesel is suffering from more than heartache over Sheik's passing.
Diesel's showing neurological signs, which we call vestibular disease. They lose balance. And their eyes start flicking, they become nauseous. And Sheik developed that about 2 months ago, and she deteriorated rapidly and started seizing. And over just the last week, Diesel's actually been having multiple episodes of vestibular disease as well. Oh. As a veterinarian, I know that old dogs can get this, and sometimes it can go away and be okay. But he's had numerous episodes, and my big concern is that he has a brain tumour or something like that. Hey, poor matey.
It's really difficult for me to see Gerardo go through this. Generally, he's the strong one and he's there as my support. And now the tables are really turned and I need to be there for him. I hate seeing him in pain and know that I can be there for him, but I can't take that pain away. I think really you've got to find out what's going on, and the only way you're really going to do that is via the MRI.
Yeah, you're right. An MRI will give us more information.
I think that's what we've got to do.
I appreciate you being here, thanks.
Thank you.
Oh. I am clinging on to some hope that it is just inflammation that will pass. There's a possibility that he might just have a geriatric vestibular disease. If that's the case, it means that he just needs time.
Come for a ride, Diesel.
So today, I'm going to take Diesel into the hospital. Oh yeah, here we go. Good boy, mate. Good boy, good boy. And have an MRI to have a look at his brain and see if there is a structural change or if there is a mass there. Just a short little trip and we'll find out what's going on.
Does it feel a bit weird to bring your own dog in?
Yeah, it does actually. Oh, it's all right, Diesel.
All right, don't panic,
it's okay,
mate.
It's okay.
He really doesn't like being carried, hey?
No, he doesn't like me.
At the Animal Emergency Service on the Gold Coast, Alex and Gerardo have just arrived. Not for work this time, but with their own beloved dog, Diesel.
Good boy.
Good boy. Slowly, we'll get there. Yeah.
The 13-year-old Border Collie has been showing distressing neurological symptoms, and Gerardo is hoping an MRI will provide some answers.
If there's nothing there, then it will give me a sense of relief knowing that we could probably persist a bit longer with medical management, and hopefully a bit more time, he'll get better. Almost there, mate. But I suppose I'm guarding myself and preparing myself for the worst. This could possibly be his last day. We'll find out what's going on in there, Hank, today. You don't like being in hospital, do you, mate?
He's a bit overwhelmed, I think, isn't he?
Yeah, he's a bit overwhelmed. I think the combination of him being in hospital here and also receiving unlimited pats from me today is making him feel a bit more stressed.
Yes, good boy.
Hey, bud.
Hi, how are you?
Dr. Peter Barron is the internal medicine specialist who'll be performing the MRI.
How you going, buddy?
Having a bit of a tough day today.
Oh, for sure. So, look, I think a brain MRI is going to be our best way of diagnosing his balance problems.
Yeah, his episodes, they're very frequent, and he gets better and then he gets worse and he gets better and he gets worse, and my biggest concern is that he's got like a tumour or something in there.
Look, it is a possibility in somebody of this age. You know, we're still hoping that he might have that old age vestibular syndrome where their balance centre just goes a little bit kooky for a while and then sort of comes back online, but fingers crossed, and hope we find good news for you with the MRI.
Yeah.
We'll take him through now and give him his pre-med and go from there.
You're a good boy, Hank.
Come on, buddy. Come on through. Gerardo hit the nail on the head when he said, I'm concerned because this has been multiple events over several days. And I think certainly with the geriatric syndrome, so this is where the balance centre sort of goes offline in older animals. You're a good boy, aren't you? It's idiopathic, which is just a fancy way of us saying we don't know why it happens as a veterinary community. And a lot of those cases will resolve. Here we go. They can have recurrent episodes. This many, this close within a certain period of time has me concerned. And that's why we're doing the MRI.
Oh, what a brave lad. A bit loud, mate, I'm sorry.
At the Animal Emergency Service on the Gold Coast, Nurse Michelle and vet intern Mel are preparing to anaesthetise Gerardo's 13-year-old Border Collie Diesel for an MRI.
Oh, your naked little arm. Yeah, my beautiful boy, you were so brave. Good boy, Diesel.
Internal medicine specialist Dr. Peter Barron wants to find out what's causing Diesel's alarming balance issues.
Diesel's anaesthetic's going quite well, especially for an older boy. We're obviously very, very cautious with every anaesthetic, but I think when they're older, we're on point with everything. So we'll proceed from here and see what we find.
Anaesthetic off, oxygen off.
1, 2, 3, you're right now.
With Diesel fully anaesthetised, Peter and his team can move him over to the MRI room for imaging.
Okay. Oxygen is on.
ISO's on 2%.
He is connected.
Across in their office, Alex is staying optimistic that Diesel will be okay.
Do you know how much longer it's going to take?
At least another hour or so. But when you're waiting, it seems a lot longer.
Yeah, it does.
I think G has already convinced himself that it's going to be bad news, almost because he needs to prepare for the worst. But I'm not so sure. I really think that there's a very good chance that the MRI could be clean.
Very happy with the positioning. Let's move out.
And Diesel may just need more time.
So basically what we've done is what they call a scout. So the machine does a quick survey of the brain in 3 different views. And so that way we can basically look at the brain in 3 dimensions. And those different settings, show us the anatomy of the brain, can show us inflammation, can show us clots within the brain like a stroke, aneurysms, burst blood vessels, those sorts of things. And of course the thing that we're hoping we don't find it, which is a tumour. Diesel's out of the MRI now, and at this stage we're just going to wake him up out of his anaesthetic.
It's been a big morning. Poor sweet lad.
Peter knows that Gerardo is desperate to hear the results.
When you're dealing with someone's pet that you actually work with, it's very, very difficult having a chat with them about findings, especially if they're negative findings.
You're waking up?
On the Gold Coast, 13-year-old Border Collie Diesel has just undergone an MRI, and a nervous Alex and Gerardo are about to find out the results from specialist Peter Barron.
Hi, Gerardo.
There's a smile.
Yeah, there is a smile. No, it's good news. Yeah, no, really, really good news for you. So, yeah.
Ooh, it's good.
So this is his brain sitting in the middle here, and all of the balance centre is towards the back of the brain. And so we want to have a look at his ears down in here, and certainly his middle ears look okay. So when we have a look at this, there's no tumours, there's no stroke, there's no ruptured blood vessels. That all looks really nice and fine.
It's a huge relief actually to know that we've ruled a lot of those big things out that I'll be worried about, especially brain tumours. So,
at this stage, I think there's a really, really good chance that, he's got this idiopathic geriatric vestibular syndrome. We don't know what causes it, but the vast majority of dogs get better with it.
So maybe he just needs a bit more time?
Yeah, lots of TLC at home. He may have a recurrence of episodes, but you know, knowing that there's no structural lesion, no tumour in his brain or anything else like that, you know, there's a good chance he'll get through. So, yeah, great news. Really good news.
That's so good.
Thank you.
Can we take him home? I was pretty sure that we'd be taking him home.
Oh, I wasn't. The MRI has given me an answer. Hey, matey. It's good to see you woke up okay. The plan of attack is take him home and continue to take care of him, making sure he's comfy and making sure he doesn't feel nauseous. Hey, I know you don't feel so good, but now we know that there's nothing bad going on in there. It's just a matter of time now until you get better, hey? And I suppose just treasuring the moments I have with him moving forward now. It's okay, good boy. Slowly, here we go. It was a real shock to the system and it really kind of brought me back to cherishing him and what he provides me. We might have to carry you, hey? Oh, I gotcha, like a big baby. Get you home, get you comfy in bed. You've been a very brave boy today. I'm really impressed with how he's going.
On the Gold Coast, it's a special day for 13-year-old Diesel after he was diagnosed with geriatric vestibular disease.
Guess we're heading today. We're heading to the beach, Diesel.
Gerardo and Alex are treating Diesel to a special outing to his favourite place.
I can imagine the inner him is like, oh my God, the beach again. He loves the beach.
You just see in his eyes how much happier he is. Whoa! He just needs a bit of help.
Yeah, he's got a permanent kind of tilt to the side, but it's so much better than what he was.
Yeah, that's just how you see the world, isn't it now, Diesel? Hey, it's just kind of this way up.
But he's doing all the things he needs to do. He's eating, he's no longer nauseous and sick.
He's doing so well.
Yeah. Well, much better than what I originally thought he would do, hey?
Yeah. Oh, yeah.
Diesel's recovery has actually been a lot less traumatic than I thought it would be. I was steeling myself for a deterioration, but he's actually just been really steady. He's eating, he's happy, he wants to walk around, so it's the best that I could hope for, and despite the fact he might stumble a little bit, there's no loss of happiness in his life there.
So good to be able to bring him out after all this time.
Yeah, and he loves being out here today.
The beach is a big part of our life, and being able to bring him back down here to where he really feels the happiest was something we've been looking forward to for so long. He's just loving being out here. And really, sometimes you just got to stop and think, you know what? This time is precious that we get to spend with our animals. I think it's brought us all closer together.
My animals mean the world to me. They're my little fur babies. I have Fred Astaire, who is my 10-year-old miniature schnauzer. I've got Elvis Presley. I think he's about 4. I rescued him at Christmas. And I have Heti the hedgehog. Is that Fred Heti? Yeah. So Heti got handed into one of our practices. She'd been found in the local park and we think she'd been attacked by a fox. She had some quite bad wounds. Who's that?
Incredibly, little Heti survived the attack, but Scott couldn't save her right eye.
She has unfortunately got neurological issues, so she can't be released to the wild because she just wouldn't survive. So she's living out her days with me. Fred, do you remember when we used to do all this work? You used to come to work with me, didn't you? See Uncle Julian?
In Gemma's former life, she was a fashion designer and even worked for the king of couture glamour, Julian MacDonald. It has been a huge career shift.
Some people thought I was crazy, but I love being a vet nurse. I feel like I make a difference to people, you know, who are really upset about certain things with their animals being sick. I can relate to them, so it's definitely the right decision for me. I really love it. Come on then, Heti Boo. You're coming with me today. We're gonna have a checkup and a bubble bath. It doesn't faze me having to deal with the poo and the wee and vomit that we have to deal with on a daily basis, but the clothes do. Let's go to work. They are the most unflattering, disgusting attire. Definitely not my choice of clothing. So that is definitely been hard. Come then, Heti. Good girl.
Gemma's now arrived with Heti at Scott's second clinic in St Margaret's.
bubble bath time. You can't have a bath in there, can you? I think Heti likes her baths. Once she's got herself in a comfortable position and she knows she's not going to inhale the water, she relaxes and quite enjoys it. So it's more a shower than a bath, hey Heti? Right, rinse time. Yeah, I love bringing Heti in because everyone loves to see her. She likes to have a little wander around the reception desk, say hello to everybody and just potters around. So it's really fun to bring her into work.
Can I come and help you? Be my assistant for the day?
Vet nurse Nathan is saying a quick hello to Heti before he's rostered on for surgery.
Oh, here's my girl. I think she's put on weight.
Never say that to a woman. I know that one.
I think Uncle Nathan called you fat. Right then, Heti, shall we weigh you? Wow, 1,200 grams. You're a big girl. Come here, you. Heti's doing really well. She was 800 grams when she first came into us and she was quite poorly, and she's now 1,200 grams, so she's put on quite a lot of weight. Good girl, Heti boo. She's healthy and happy, which is fantastic, but she is a little bit chubby, so I think I'm gonna have to put her on a diet. She's got a really bright future ahead of her though, and I'm so pleased that she'll be spending out her days with me because I love her very much. Good girl. Do you want your blankie?